So I want to welcome everybody to the 4th annual Gregg Stracks Leadership Summit. It is fantastic to see everyone here, new friends, old friends, an incredible interprofessional crew of people that are coming together for a leadership weekend, as well as friends and supporters in the Boston area. We are delighted, we are honored that Microsoft has allowed us to use this incredible, gorgeous space again. Can we just give Microsoft a round of applause? And somebody tweet that Microsoft rocks, please. But you know what's most amazing is that this has been this kickoff reception has been a tradition for us for a while. And it's a great way to kick off the weekend, bring all of our participants together, bring you folks together with other folks who are here in the Boston community to learn, to network, to share, and especially for those of you who are from outside of Boston, the opportunity to really spend the entire weekend getting to see all of Boston. You're not going to leave this room, but you'll get to see all of Boston the entire weekend. So in this room right now, we have doctors, we have nurses, we have nurse practitioners, we have dentists, we have pharmacists, PAs, social workers, patients, the full glorious physical therapists, occupational therapists. We don't have a musical therapist, though, in the room. And one of our chapters specifically is working on that constituency. We're going to help you. It's going to happen. This is the full, glorious primary care team. And I think tonight and this weekend, it's really about weaving it all and all of us together. So this conference is named after the late Gregg Stracks, who was a dear friend of mine, of many of ours. And Gregg was a management psychologist, a founding member of PCP, and a coach who worked with us until he succumbed to metastatic ocular melanoma a few years ago. And Gregg believed in people passionately, and he was committed to interprofessional collaboration, interdisciplinary collaboration, and helping people really grow into their best professional selves. And he taught us a tremendous amount. And we really have tried to take the essence of his approach and have it really be the foundation of everything that we do at PCP. And as Kyle Turner, one of our national coaches, put it, it's not just about the amazing campaign that a chapter runs to advance primary care. What this is really about, the outcomes that we're after are also the people. Right? The outcomes are the people. And what we're trying to build is an interprofessional cadre of change makers in primary care. And I'm talking about people like Krista and Steph, two of our national coaches. I'm talking about groups like PCP Colorado. I'm talking about systems like the Wright Center and Iora Health. Folks who are really taking it to the next level, people and systems. So it has been amazing watching the summit come together. I want to do some shout outs really quickly and give heartfelt thanks, first of all, to the PCP national team and our board of directors who've been working incredibly hard to make the summit happen. Long hours, collaboration, coordination, integration, everything else. And they've been supported by an incredible crew of interns. Can we get our interns to raise their hands? Katie, Antea, Sahar, and Lauren. And by the way, the amazing slideshow that you guys have been watching was created by Lauren. And it's incredible. It's so professional. It's so awesome. You can never leave. I also want to give a shout out to our volunteer coaches, our trainers, the folks that many of you guys are going to get to work with this weekend and beyond. They are the gold of our training enterprise. They're incredible. They've donated countless hours both to this weekend and what's going to be happening in the months to come. And you are so lucky to get to hang out with them. Can we get all of our coaches and facilitators to raise their hand? Give them a round of applause. And then our chapter leaders, our faculty and staff advisors, raise your hand. The summit participants, all right? I mean, you guys are really, you guys are why we're here, why we exist. And we thank you for your passion, your commitment, your energy. It is the fuel that drives our engine at PCP. So this is about you. And last but not least, we want to thank our sponsors, all 21 of our sponsors. This event would not have happened without incredible generosity, starting with the donation of this space. And I want to give a shout out to our 5 champion sponsors, the Josiah Jr. Macy Foundation, the Institute for Healthcare Transformation at the University of Utah, Microsoft, obviously, Camden Coalition of Healthcare Providers, which has been an amazing partner to us, and 5 Dynamics. These folks have just been incredible. And please take a look tonight at our list of sponsors. Many of those folks are in the room, and for those of you who have who've received scholarships to be here, please go up, please thank them, please tell them why you're so excited to be here and all the awesome things you're going to do with their training, and your phone number in case you don't. Speaking of the scholarship fund, Katie, wave your hand. It is still open, and we're still paying the bills, so feel free to go over there and make another donation to the scholarship fund. It's never too late. Now, before I introduce our keynote speaker, and I am really excited that you guys are going to get to hear from Rashika tonight, I want to share some thoughts, some brief thoughts. And I know the entire PCP team is like, oh my God, he said brief thoughts, and he's had a bit to drink, and he's got a mic. Now, some of you might know this about me. In my 4th year of medical school, I almost lost my mom, essentially because she didn't have primary care. She ended up on a ventilator in the ICU with acute respiratory distress syndrome and came very close to dying. And you might say, how did a perfectly healthy 61-year-old active substitute teacher end up with acute respiratory distress syndrome? And she developed pneumonia. It went untreated, and she didn't have a primary care. She didn't have a primary care provider. She didn't have a comprehensivist. She didn't have someone focused on the full her. She had a bunch of specialists, but she didn't have a primary care person. That could have been a nurse practitioner. That could have been a PA. It could have been a doc. She didn't have one, and she almost died. And as I sat there in the ICU staring at the consequences of what happens when people go without primary care, I thought to myself, wait a sec, I'm going to a medical school that is actively discouraging me from becoming somebody else's primary care provider. And, it just felt like we are, sort of marinating in this anti-primary care culture at a lot of schools. And it wasn't just the school that I went to back in, whatever it was, 2003 to 2007. It's kind of happening to more or less a degree at all health professions, training schools, that we're marinating in this anti-primary care milieu, this complicated stew of policies and historical legacies and culture and language and humor that largely devalues primary care and those who provide it. And it's like this mountain of challenge. And I'm wondering how many of you feel overwhelmed when you think about this mountain of challenge that we're up against in primary care. How many of you guys feel overwhelmed sometimes and wonder, what the hell can I do? I'm just a person. I'm just one person. I think that thought goes through a lot of our heads quite frequently in primary care. And I think it makes total sense because we're up against a lot. But here's the thing. I don't think you guys would be here if that's the only thought that went through your head. I think there's a parallel thought, an idea, not an idea, a certainty that we can do something about these challenges, especially if we work together. And that certainty, my sense, that certainty, the volume on that certainty has been going up lately as we see more and more of our colleagues, people like Rashika, who are finding ways to fight back against these challenges. And as we're hearing more and more about the pro-primary care policies and the investment that are enabling folks like Rashika to make these changes. And I think, if you'll allow me to use a surfing analogy, and I'm not a very good surfer, I'm actually a very bad surfer, but I recently was able to carve a toe-side turn on my shortboard, which is pretty awesome, so now I have self-esteem again. I think more of us are starting to see that there is a wave of support building for primary care. Not a wave of water, but a wave of support. And it's big, and it's beautiful, and it's powerful. And I think more and more of us are looking at it and saying, I can ride that wave. I can ride that wave to do amazing things. I can ride that wave. We can ride that wave to advance graduate medical education reform. We can ride that wave to make reimbursement reform a reality. And you might say, okay, Andrew, that's very general. Do you have any specific ideas about how we do that? And then what I'd say to that, and what this conference is really about in a lot of ways, is that I think we're going to use a continuation of the really smart strategy that a lot of people in this room are using to take on big problems. And that is, we're going to couple a technical approach to the problem with a relational approach. Said a different way, we're not just going to focus on the what and the how, we're going to focus on the who. So when we are dealing with a dean and we're trying to get curriculum reform through, we're not just going to focus on the data and the curricular proposal and what it looks like on other sides of the country and the outcomes we expect. We're going to think about that dean and what she or he actually care about, their interests, their motivations, and different things that we can do to leverage it. And we're going to put that package together. Hooray. The technical Hooray. And the relational. Because if we do that, we're going to get a lot more done. Now, hold on. Thank you. Thank you. Thank you. Now, here's the thing. To be sure, this is different than how we normally operate. To be sure, this is different than how we train. But what we think at Primary Care Progress is that we need to develop a range, a wider range of approaches that we can use as change makers to the problems that we face, the big problems, where we cannot take them on alone. You've been trained to take them on alone, but the big problems we can't take on alone. But if we take this combination of a technical and a relational approach, we're going to get more stuff done. And at Primary Care Progress, we're committed to helping you become an interprofessional cadre of change makers in primary care who are just as capable of dealing with issues about the what and the how of a problem, as well as the who. Now notice something. At no point have I said, we need more primary care doctors. We need more primary care nurses. We need more primary care nurse practitioners and pharmacists. Those are all true things. 100% true. But I think more desperately, we need more primary care change makers. Because that's the only way we're going to take on these problems, right? That's the only way we're going to be able to run the marathon called the revitalization of primary care. Okay, what should the participants expect from this weekend? Fantastic, look, isn't that wonderful? Okay, so specifically, we've brought together what we think is the best curriculum right now that we can muster in primary care, relational leadership, change making. I'm going to say it again. That was a mouthful. What the hell does that mean? Matt was just looking at me like, what? Basically, the leadership practices that you're going to need to be a change maker. We've put together a curriculum on that. We've got an amazing crew of coaches and facilitators. Our hope is to build a foundation of leadership practices that you can take home, that we can build upon in the coming months. And we're committed to you. This isn't just about this one deal here. All right? This isn't going to be a flash in the pan exercise. We are committed to working with you and coaching you and supporting you going forward. So that's number one. Number two, this is a space for us to connect. This is a space for us to weave ourselves together. There's an incredible crew that we've got here. Different professions, different stages of training. We've got students, we've got faculty, we've got staff, we've got patients. Right? This is about relationships. This is about people. So we want you to use this space, this incredible space. Explore it. Go hang out with people. Have a drink. And finally, fun. We're going to have fun this weekend. Now, why is that important? Well, the campaign to save primary care, it's going to take decades. Right? We're going to be working on this until a lot of us have white hair or no hair. And if we can't have a good time at the same time we're dealing with this stuff which is really tough, we're not going to be able to run the marathon. So we're going to have fun. We're going to have a good time. And that was a little preview of the fun we're going to have. Yeah, oh yeah. Get ready. Well, listen, it is my great honor now to introduce Dr. Rishika Fernandopulle. So, if there's anybody who gets relationships, it is Rishika. Now, Rishika is a practicing physician. He's the co-founder and CEO of Iora Health, which is doing incredible stuff in the primary care revitalization space, has practices all over the country. And a little bit more on Rishika. In 2012, he received an Ashoka Global Fellowship. He is a member of the Albert Schweitzer Salzburg Global Fellowships. He's the first executive director of the Harvard Interfaculty Program for Health Systems Improvement, the managing director of Clinical Initiatives Center at the Advisory Board Company. Rishika received his AB, his MD, and his MPP at Harvard, and he did his clinical training at UPenn and Mass General Hospital. And I remember vividly when I first met Rishika. It was during my residency. I was suffering from primary care despondency syndrome and having trouble seeing a future for myself in primary care. And Rishika was talking about Iora and some of the practices. And I remember just being blown away. And three things stood out to me. Number one, how enthusiastic he was about not only his future in primary care, but all of our futures in primary care. And I remember that was so different from other people I saw talking about primary care. I was like, oh my God, what is he smoking, and can I have some? Secondly, Rishika was clear that primary care was being reinvented, and every person in that room could be a part of it. And that felt incredible to hear. And thirdly, as Rishika was talking about all the different things that made the practice and the system work, it was so clear that underlying everything, the relationships with the patients, the relationships with the providers, the relationships with the system, was just this profound commitment to getting relationships right. It wasn't that he thought relationships were important, it's that he kind of made clear that relationships were it. And that if you didn't get the relationships right, forget about it. It's all yours.
Thank you.